Hello, I'm Jorge Alio. I want to thank the All India Ophthalmological Society to be invited to this wonderful Congress. The topic of my presentation will be the outcomes of corneal graft surgery in 2021, whether they are still a problem. I have no financial disclosures related to the topic of this presentation. We know that there has been a continuous growth in the volume of surgical corneal transplantation. We have focused our interest in Spain, our country, in which from 2001 to 2016, 90,494 corneal transplants were performed according to the Organización Nacional de Trasplantes in 2018. Obviously, there is a progressive aging of the Spanish population, which is leading to more indications, and indeed the introduction of new modalities of corneal transplantation, such as anterior-posterior corneal laminar grafts, induce more and new indications. There is an extensive bibliography seeking the visual outcomes of corneal transplantation and risk factors affecting graft survival. However, the literature is scarce in defining the different causes of graft failure in each type of corneal transplant. The test of corneal failure should be considered in two types. One is the anatomical failure, which is a decrease in graft transparency, which is to be considered as a failure of the tissue. Second, we have a potential functional failure in which we get inadequate visual outcome. This is a failure of the outcome. The main questions in modern corneal graft surgery are the following. First, which are the current anatomical outcomes of corneal graft surgery? Whether the modern techniques that have emerged in the last years are improving such outcomes. What is the failure rate of the different modern corneal graft surgery? And which are the main causes of modern corneal graft failures? We have in Ophthalred a multicentrical national collaborative network for clinical research in Spain, sponsored by the Spanish government. And we performed a large retrospective 10 years multicentric study. We performed the study in the main centers of the national network of clinical research, aiming to identify the causes of failure of the different corneal graft techniques: penetrating keratoplasty, deep anterior laminar keratoplasty, DSEK, and DMEK. We have published all this information in this interesting and important paper in 2021, in which we will see most of the contents of this talk. Which were the indications for corneal grafts? As you see, the indications for PKP were bullous keratopathy and endothelial dystrophy, keratitis, leucoma, and trauma as the main indications. In deep anterior laminar graft was keratoconus, herpetic keratitis, and stromal dystrophies. And in DSEK and DMEK, endothelial dystrophy and bullous keratopathy were the main indications. Penetrating keratoplasty is still the most frequently performed corneal graft in Spain. The main indications for surgery, as you have already heard, were bullous keratopathy, followed by the presence of endothelial dystrophy, leucoma, and keratitis complications. Consider, with an overall positive prognosis in general, in the long term, but survival rate at 5 years varies, ranging from 63.7% to 83%. Not that successful, as you can see. In deep anterior laminar graft, the main surgical indication was keratoconus and corneal ectasia, followed by herpetic keratitis. When surgically successful, it is a safer corneal transplantation procedure. So the best long-term anatomical survival rates from 85% to 98% at 5 years. And this could be explained by lower risk of immunization compared to penetrating keratoplasty. This is mainly due to the absence of endothelial reaction. Its surgical indications are performed for keratoconus and corneal ectasia, which were 64.3% of the eyes, and patients are mostly younger with less ocular comorbidity that can lead to complications. The outcomes of modern keratoplasty for DMEK and DSEK were endothelial dystrophy in 58.3% and bullous keratopathy in 30.6%. The anatomical survival rates were from 79.4% to 96%. And it has been reported that endothelial keratoplasty survival increases over time along with surgeon-centered experience. Which were the causes of the failures of keratoplasty that we observed in our study? The main causes were primary graft failure, immunological rejection, and non-rejection cause. Primary graft failure is indeed the one that happens when the corneal edema happens from the first postoperative day and transparency never recovers. Immunological rejection, on the contrary, is when an immune reaction happens, causing graft decompensation from a previously successful graft and transparent. And non-rejection, indeed, are those that are not classified in the previous categories, like endothelial decompensation without rejection, glaucoma with high intraocular pressure, diseases of the ocular surface, recurrence of the primary disease, wound adhesions, hypertonia, and trauma. The causes of failure are listed here. In primary penetrating keratoplasty, the main reason was immune rejection, followed by late endothelial failure, glaucoma, and ocular surface disease in general. Penetrating keratoplasty reoperations were affected by the same causes and with a higher participation of ocular surface problems. In deep anterior lamellar graft, the main causes of failure were the problems related to the disease and glaucoma. Indeed, it is an important problem, ocular surface disorder in these cases, as far as they were the first reason of failure. In the SEC and the MEC, it was immune rejection, followed by primary failure. It's clear, as you see in the bars, that immune rejection was less frequent in the MEC, and glaucoma also was less frequent in the MEC. Penetrating keratoplasty failure, indeed, has been one of the reasons of concern of surgeons for many years. There are many studies that have shown that it's multifactorial and it's a progressive process. The underlying mechanism, even that we have studied a lot, is not completely understood, especially the one that happens in late failures. The endothelial failure is considered to be the major one and could be acute with endothelial failure due to immune rejection in the early stage, or chronic, in which endothelial failure is caused by a progressive cell decline long-term over 10 years following penetrating keratoplasty is observed, even without evident rejection or evidence of intraocular inflammation. Deep anterior lamellar graft failures mainly happens due to ocular surface disease, like limbal stem cell deficiency, infectious keratitis, keratolysis or persistent epithelial defect, and herpetic eye disease and glaucoma. DMEC failures have as the main reason endothelial decompensation without rejection, which happened to be in 31.9% of the failures. Primary graft failure was the main reason of failure in the MEC population, with occupying 64.1% of the failures. The majority of failures in the MEC, 77%, and the SEC, 51%, happened in the first year after the surgery. It is obvious that learning curve is happening in this series of cases as far as it was included in the centers that were affected by this study. In other words, the learning curve is affecting the outcomes probably and reflects the real world when you start this technique in any hospital. So we need strategies for failed grafts. First, we need to address immunological problems and ocular surface problems and glaucoma, as far as they are the main reasons of failure in penetrating keratoplasty. The second, they make a novel therapeutic strategies for failed penetrating keratoplasty grafts and have a potential superiority when compared with repeated PRK. But remember, they have a learning curve until satisfactory results are obtained. In summary, the question of this presentation is, are the outcomes of corneal graft surgery in 2021 still a problem? The answer is yes, they are. We need to optimize the anatomical outcome of modern corneal transplantation techniques. The main reasons for failure in general are immune rejection, ocular surface inflammation and dry eye disease, and glaucoma. And there is a need to look for new solutions based on modern approaches such as advanced therapies and stem cell corneal regeneration. If you want to go further into this topic, this is one general review that we have done in this paper published in British Journal of Ophthalmology in 2021. This is a paper in which we have the outcomes of the multicentric study of the causes of corneal transplantation failure in Spain, published also in 2021 in Acta Ophthalmologica. There's another paper in European Journal of Ophthalmology in which you have the corneal graft surgery, a monocentric long-term analysis in which you can see what is the coincidence of the multicentric analysis with a monocentric analysis, what means that what we obtained in the multicentric study is essentially what you should expect to have in your center as far as you have expert and talented corneal surgeons. Finally, I would like to remember to you that we have this online course on refractive corneal lens surgery as an international university specialization course. course. All of you are invited to join this course, which includes 500 hours of teaching multimedia material, fully in English, and with a lot of information that you will find very interesting in the medical education in ophthalmology in these specific areas of specialization. Thank you very much for your very kind attention.